Today 3D printing has a potential in every aspect of manufacturing, and this is a unique initiative and which I feel would help each and every seeker in this domain to further his interest and grow the technology.
It is going to bring about a revolution. You can think that a world without a disease, without disability.
Today I can say that whatever that you can imagine can be actually put into practice with the medium of a software to print or give substance to your ideas with the help of 3D technology.
It's been our conscious effort in terms of want to communicate and create the awareness.
Faster and better, and it's easy for people to access it and make interesting products out and take their imaginations into reality.
This is a platform where we can promote these technologies
for a simple reason, because 3D printing is a technology which is going to change the way things are.
Plastic, present in so many aspects of modern life, can easily turn into a source of microorganisms such as fungi, viruses, and bacteria due to its porous surface. Your cell phone case has a bacterial load greater than 30 times that of a public restroom. In everyday objects, this might not pose a threat, but in the case of a medical device such as a 3D printed prosthesis or orthosis in direct contact with a patient's skin, could cause serious skin infections because of microorganisms lodged in it, hindering further treatment and raising the costs involved. This is the case for 40% of said patients. It was this number that pushed us to think and develop a way to solve the problem of bacterial load in plastics, especially those used in the 3D printing industry, once and for all. After months of research, we turned our attention to an emblematic material for our country, which would help us find a solution. Copper, one of the strongest bactericidal elements in the world, according to the EPA. Copper nanoparticles embedded into the material structure free copper ions that break the microorganisms' membranes and even alter their DNA, eliminating them completely and keeping the material free of pathogens. We're excited to imagine the global impact that a material like this could have in everyday life, in 3D printed objects for all uses in all areas. A world free of bacteria. Amputees will benefit from this new generation of antibacterial materials. Industries and people will be positively impacted by this development. Industries such as veterinary and medical devices, food packaging, kitchen utensils, toys. We want to make plastic a clean material. We want to start the antibacterial 3D printing revolution. We need you to turn this project into a reality. Our material will soon be available. Sign up at copper3d.com so you can be one of the first people to try our revolutionary material. Help us start the antibacterial 3D printing revolution today.
Welcome you all to this wonderful edition, one more edition in terms of the 3D Graphy news interview. And today we have an opportunity to interview Claudio Soto, who is the director and the co-founder of Copper 3D, a company who is actually manufacturing antimicrobial materials. And they have a product which is very unique in terms of the offering, because these are the materials which can be really used in terms of in the medical practice for medical equipments and various different solutions. Because today doctors, for them, you need customized tools, medical tools, which will actually make it more easier and convenient, and they can plan their surgery accordingly. And it is also in various applications in terms of fixtures, also in terms of how it can be used in hand plas for orthopedics, and there could be multiple applications. And now that we know that there is an opportunity, we have the senior most from the organization, Claudio, who will actually share what is the prospect and where did it all start. So Claudio, thank you so much for your time. And may I now ask you, where did it all start, Claudio? The business, as in your company, Copper 3D. What was the aspiration?
Oh, okay. Thank you so much, Doctor, for this invitation. Yeah, our aspiration, very good question. Right now, we are working in a different solution on different materials, antimicrobial, by the way, and for FDM technology, for SLA as well. So we would like to democratize our technology, maybe in the near future to use our material and enter with our material into the Indian market, because we are totally sure that our material can help and save lives globally, because we tested our materials in the antimicrobial performance sense in different parts of the world. The performance is pretty awesome. We are capable to kill consistently germs in all the 3D printed tools, device.
Materials are filament-based materials, right, Claudio?
Yeah. Now we have filament materials based on PLA, called PL Active in English, the commercial name. A flexible material based on TPU called MD Flex for FDM technology. But now we will launch resin, antimicrobial resin, because in Chile we have a small project developing surgical guides with this material, in surgical guides for orthopedic surgeries, and works.
Yeah. So which are the sectors and industries that these materials can be used today? And I'm sure it is all certified because it's antimicrobial, so it goes without saying that it is certified, and it is FDA approved.
Our material is FDA approved, EPA company registered. In EPA is Environmental Protective Agency in the US, and we are working in healthcare sector, but maybe this material should be used in thinking in toys, in aeronautic industry. We work in a couple of projects with NASA, because the antimicrobial materials, it's the capability is so big, because as you know, because the COVID-19 pandemic, all the people aware about the possibility to use antimicrobial materials in order to kill viruses and bacteria and fungus.
One more thing that I wanted to understand, Claudio, is now this is an antimicrobial material. Can it be actually be used for C2 implants, as in for implants within the body? Is there a possibility of using this, or it is still time for it to get approved?
We test our materials in India, by the way, using international standard regarding the biocompatibility. This is a breaking news, because in Brazil, one of our partners working on implant for different part of the nose. Maybe in the near future we can use other materials, thinking in implants. We have a prototype with titanium, antimicrobial titanium, and that's the future. The future of medicine is the personalized medicine, and the 3D print industry has a lot of future. I don't know if I'm explaining.
Yeah. We also understand these antimicrobial materials for various surgeons today. While the surgery is being conducted, these medical equipments and the device needs to be sterilized. In situations like where sterilization, if it is not done with, there could be a cause of infection. So while surgeons might be an expert to get the surgery done, devices needs to be sterilized, and because of that, probably a mistake there could be a issue in terms of the infection. But here is a possibility with an antimicrobial material, which is more when it comes to safety, this is actually being taken into consideration as one of the options. So do you have that kind of a penetration globally in these hospitals, Claudio, in terms of for you to have introduced in your country when to begin with?
We regarding the penetration of our material, we have here in Chile working with one of the most important trauma centers to develop surgical guides, one of the most important NGOs to address some antimicrobial prostheses and ortheses, and so on and so forth. In the UK, we receive a lot of information from our customers because they are selling our materials to NIH hospitals, and receive some requests from some healthcare facilities in the US. So maybe our next step is to enter in the Indian market, because this is very important for us. Let me tell you something about the data. 50% of hospital-acquired infections are due to the high bacterial load on the medical device surface. So it's important. It's important. It's probably an invisible epidemic, the antibiotic resistance. But, for example, if as a clinician don't solve the antibiotic resistance, and we are not able to address this problem by 2050, in the near future, more people will die from the antibiotic resistance than they cause from cancer. So it's a very, very important problem to tackle.
Right, very true. So I think the need is now for maybe medical institutions and also hospitals, very specifically, to take that as into account. So we also are assisting hospitals now to help them to set up these labs as point of care. What do you think, Claudio? How will this help the larger interest of the hospitals to be, will be well equipped in terms of the services? If you have any testimony to share about any of the hospitals, I think it would be great.
Yeah. Now we are in the middle of the negotiation here in Chile to establish point of care in one of the most important sport center and we have. But in my opinion, the future of medicine is the customized medicine, personalized medicine. In the near future, all the hospital should be get point of care and in-house 3D printed lab in order to produce different solutions for different problems into the healthcare facility. For example, I don't know, ortheses, insoles, prostheses, or surgical guides, medical device, thinking in the patient, just for this patient specifically.
Customized.
The future, customized. Yeah.
So I think that's the future. So Claudio, thank you so much for your inputs. I'm sure the product has great values that you have been able to see that it gets proliferated globally. So in this space, which are the countries that you have been proactively sourcing these materials?
As a company, we have agreement in America, in the US, in Australia, Middle East, specifically in Dubai, and in Europe, in different countries in Europe. We are so eager to enter in the Indian market because we can help to save lives in your country.
Right. I see an opportunity there, and I'm sure we can look at discovering or trying to see if there is a possibility of an affiliation going forward, because I think it's important that there needs to be awareness. I think the first thing is the awareness, and subsequently, if the product is good, I'm sure we will have more take. And very effectively in terms of the way you have been able to design in terms of the product and with all the certification, and being an antimicrobial material itself clearly mentions it all. So thank you so much for your time, Claudio, and wishing you all the very best for your pathway set for this product, and may your product have that kind of a reach, so for people to benefit. And thanks for your inputs, Claudio, and have a wonderful day. Thank you so much.
Thank you so much.